Next one we're going to talk about right now is Docusate sodium. So this is a surfactant laxative. So what it's used for, let's start with the indications. It's for prevention of straining during the defecation, which is going to the bathroom, and constipation associated with hard stools, the relief of occasional constipation. All right, so this is what it's used for, these surfactant laxative, which is Docusate sodium. It's hard for me to say. So how this works is it reduces that surface tension of the oil and water of the stool, resulting in enhanced incorporation of the water and fat to get it to go through your intestines more. So it's called a surfactant laxative, the way it works. All right, so in the PowerPoint, they were very specific about the dosage we use for children and adults. So adult and children over 12 years of old, and so I think of like adult being like 12 for bat mitzvah age. So I use 12, so over 12 bat mitzvah age, we have 50 to 500 milligrams per day. If we're under bat mitzvah age or bar mitzvah age, whatever, if you're a guy or girl, children 6 to 12 years old, they're gonna have 40 to 120 milligrams per day. So one more time, adults 50 to 500 milligrams per day, and children are 40 to 120 milligrams per day. All right, so now we're gonna look at all the adverse effects, contraindications, what you'd monitor as a nurse. So the adverse effects you're gonna have you can get occasional mild transitory, so it's like transient of cramping, diarrhea, or rashes may occur. So this because especially if you don't drink enough water, you want to call the healthcare provider immediately if you see any rectal bleeding or rectal irritation. If you see rectal bleeding or rectal irritation, you call your healthcare provider because there's complications with this drug. All right. So some contraindications is when you use self-medication, make sure you do not use it more than 7 days because you're not supposed to. But if you feel you want to use it more than 7 days, you're going to have to call the healthcare provider, get a special prescription, but over the counter, no more than 7 days, very dangerous. Do not use if you have an abdominal pain already because it can cause more cramping, nausea and vomiting, all the enteritis. So enteritis, diverticulitis, ulcerative colitis, you have inflammation, you don't want to be making it more inflamed or irritating it. Or if you have mineral oil, it will cause extra GI absorption of that oil. All right, so also they're only referring to mineral oil as the oral type, okay? So also it's contraindicated for surgical surgical in the abdomen area. Why? Because your abdomen is gonna be really sensitive during this time, and it's really dangerous if you need a strain and it may cause disruption, so you wanna be really not irritating the areas if they have a surgical surgery on the abdomen. Fecal impaction, which is very interesting because we're talking about Docusate sodium, which is supposed to help with this constipation to begin with, but if you already have fecal impaction or obstructive of the bowels already, then it's really contraindicated. This is just used for constipation in general. So chronic maternal overuse, if it's been known for hypomagnesemia in infants, probably because you're releasing, whenever you take a laxative anything, you're releasing all that fluid, possibly electrolytes could be lost with it. But this can, with prolonged overuse, it can cause the child, the infant, to be born with hypomagnesemia. So if the baby is born and the mother was taking this for a certain amount of time, you're gonna wanna look at those magnesium levels of the infant. And infants have different mag levels probably than adults, of course. We're gonna want to teach those patients not avoid prolonged use and that this should only be used for short durations and only when it's needed. So very much caution for pregnancy, we know that. Now patient education, what do we need to know? We need to know that with this medication, take it with a full glass of water. It's gonna cause that cramping and diarrhea. You need to have water, plus it's a surfactant. You're absorbing that water and that oil with it, that's what it does. So you need the water in combination with it. All right, so we're gonna mix 50 milligrams per 5 milliliters, right, with milk or with juice. Why are we gonna do that? Because it's been known to cause throat irritation. The milk or juice will cause it to not be irritated as much, and this is just an adverse effect. All right, the lowest effective dose is what is advised that will be effective, right? But you only use this Docusate sodium when it's necessary because there's other laxatives that are available on the market, okay? And contact healthcare provider before use if you have nausea and vomiting, which is contraindicated. Remember, stomach pain if it persists, or sudden changes in your bowel habit that are like really drastic. Also, if it persists more than 14 days, the main thing is call your healthcare provider if you have bleeding or irritation in your bowel, in your rectal area. Okay, the bowels may fail. If the bowels fail to occur within 7 days, call your healthcare provider because you're not supposed to use it longer than 7 days. The drug interactions, the two that we're going to look at is the aspirin. Aspirin can cause intestine mucosal damage, right? So together, this can cause more risk for that mucosal damage for the aspirin, because remember, aspirin ulcerations are at risk. And also the mineral oil, it will increase your absorption of the GI absorption of your mineral oil. So that is everything that you need to know for Docusate sodium.